Assistant Secretary Carlos Bernardo Abad Santos.
Good morning, everyone, and I'd like to thank the organizers for this forum for inviting NEDA to present the Philippine Development Agenda and looking at its links to the Health Development Agenda. So I was asked this morning to highlight the value of universal healthcare in communities in achieving the goals of the Philippine Development Agenda. Now, the Philippine Development Plan 2017 to 2022 was already approved by the President. It was approved by the Cabinet in February 20, 2 months ago, and we would have a launch of the PDP on June 2 with the President in SMX in MOA. So that's the grand launch of the PDP. And the legal basis for the Philippine Development Plan is Executive Order number 5, which authorizes, adopts, EO5 adopts Ambition Natin 2040 as the long-term vision of the Philippines. It is also mandated by Memo Circular number 12, which authorizes NEDA to mobilize the entire government towards the formulation of the Philippine Development Plan. The plan is also anchored on the 0+10-point socioeconomic agenda of President Duterte and in the Sustainable Development Agenda 2030. So, as I said, Ambition Natin 2040, and the intro says that Ambition Natin 2040 is a main anchor for the development plan. And Ambition Natin 2040, or the Philippine long-term vision, was a substantive research initiative of NEDA. Basically, we conducted extensive consultations and FGDs all over the country. We validated the findings of those consultations with a national representative survey among the Filipino people, and we looked at the empirical basis for the long-term vision through technical studies, through 10 technical studies. And I'd like to take this opportunity to thank Asian Development Bank for assisting us in conducting those different technical studies to inform the long-term vision. And the anchor is basically we ask the Filipino people what they want to be, what they want to do, and what they want to have by 2040. And that's simply the basis for all. And from the focus group discussions and from the survey that we conducted, we found out that the Filipinos want a matatag, maginhawa, at panatag na buhay para sa lahat. So by 2040, they say that they want a matatag, maginhawa, at panatag na buhay para sa lahat. Aspirations are family-centered, because when you talk to the children, they say that they want a comfortable retirement for their parents. When you talk to the parents, they say that they would like their kids to graduate from a good university, have a successful and a decent job. So it's family-centered. And the closest we can translate matatag, maginhawa, at panatag na buhay para sa lahat is that we have strongly bonded relationships, or matatag, which means we live together with family and friends, and we get time to spend with family and friends. We have work-life balance, and we have opportunities to do volunteer work for the community. A comfortable lifestyle, or maginhawa, means that we are free from hunger and poverty, that ownership of our home is secure, that we have good transport systems so that there are no barriers to mobility, and we get to travel and have a vacation once in a while. And a secure future, or a panatag, means we have enough resources for our daily needs and unexpected expenses, that we feel secure wherever we are, and that we expect to live long and healthy lives, and we can retire comfortably. So this is the aspirations of the Filipino people. And based from these aspirations of self, we translated it to a vision statement for the long-term vision of the Philippines by 2040, and that by 2040, for Filipinos to live a matatag, maginhawa at panatag na buhay by 2040 means that the Philippines will be a prosperous middle-class society where no one is poor, our peoples will enjoy long and healthy lives, are smart and innovative, and will live in a high-trust society. So the next challenge is translating the vision into reality. And we, of course, need to take action. And from the government side, Ambition Natin 2040 has to be the anchor for development planning across administrations. So it will span 4 medium-term development plans. Beyond the term of the current administration, we need to ensure that the next plan builds on the gains of the 2017 to 2022 plan. We have to have a progression of plans instead of changing plans each time there's a new administration. Nonetheless, there has to be some flexibility to adapt to unexpected developments and changing needs and preferences. And this is the reason why we went short of formulating a long-term plan, because we wanted to formulate a long-term vision, identify the goals, but then leave the strategies to achieve those goals for each administration. And so you don't box them in, and it will not make them the propensity for them to change or to rebrand the plan. So basically, we will have to look at what are our targets for each of these. For a prosperous, predominantly middle-class society where no one is poor, our peoples will live long and healthy lives, be smart and innovative, and live in a high-trust society. And basically, for where no one is poor, the target is zero poverty by 2040. And basically, that would mean, is it achievable? Yes. That would mean tripling our per capita income over the next 25 years to achieve zero poverty. And to basically have a predominantly middle-class society. For long and healthy lives, the target is a life expectancy at birth of 80 years. So that's, and then we will now have to move backwards across the 4 development plans to see, to basically chart the path towards achieving the long-term goals. Now let's go to the Philippine Development Plan. It is uploaded in the NEDO website, and we are currently finalizing the results, the detailed results matrices. So basically, we're now again back with our different planning committees. So those of you who are in the different agencies know that makulit po kami calling the different planning committees so that we can identify the medium-term targets for the outcomes and major outputs. Because the detailed outputs will be an agency plan. We don't like to make the development plan a compilation of different agency plans. We want to look at what are the major outputs and what are the outcomes, the targets for those. Now, the framework for PDP, we have here the framework that we use in writing and formulating the plan. The PDP 2017 to 2022 we shall aspire to contribute to the attainment of Ambition Natin 2040 by laying down a solid foundation for more inclusive growth, a high-trust society, and a globally competitive knowledge economy. And then we align this with the current administration's battle cry of malasakit, at pagbabago. So we have three main pillars. And the middle pillar is inequality reducing transformation. That's, I think, a substantial pillar. And the theme of that pillar is we want to reduce inequality, both in economic opportunities and both in human capital development. So that's a theme. Into the planning, we said who were left behind in terms of economic opportunities, in terms of sector, people group, and area. So for let's say, for economic opportunities, you would see that the ones who were left behind were the agriculture sector and certain regions, especially those outside of Metro Manila and in Mindanao. With regards to human capital development, again, looking at who were left behind in terms of spatial, in terms of location, in terms of people groups. So you're looking at Caraga regions, Region 8. You're looking at IPs. You're looking at some sectors, some vulnerable sectors. So you're looking at that, who were left behind, and that should be the main focus of the interventions. And so the middle pillar is reducing inequality, both for economic opportunities and for access to human capital development and access to social services. So that's the middle pillar. The left pillar is malasakit, or enhancing the social fabric. That is, the aim is to regain people's trust by making public institutions citizen-centered, efficient, and clean. The right pillar is patuloy na pag-unlad, or increasing the growth potential. Here, it's that eventually we need to invest right now for the future. And we would graduate later on from a factor-based economy to a knowledge-based economy. And if right now we do not invest in science, technology, innovation, then we would not be able to maximize or harness that opportunity later on when we transition, or we have to transition to a knowledge-based economy. So we have to look at that. And also part of that is looking at the demographic dividend and making sure we're looking at it now, so that later on, 15, 20 years from now, depending on the scenarios, is that we can maximize that demographic gift. And finally, we have what we call the bedrock strategies. They're the four strategies that we call cross-cutting, and these are very important because these are the foundations for sustainable development, and they affect the three pillars. This is peace and security, infrastructure development, clean, ecological integrity, and clean environment. So that is the framework where we use to develop the Philippine Development Plan. Now, the plan has 21 chapters and 7 sections, or 7 parts. Now, just to situate, chapter 10 is where most of the health agenda is located, and that's accelerating human capital development. It's part of it's part of part 3, looking at inequality reducing transformation or pagbabago. So basically, it's chapter 10. However, I mean, health is not isolated. So there are links to other chapters. And among the prominent links are the link to chapter 11, which is reducing vulnerability of individuals and families. Because there you need to look at your social health, your health insurance program and other social protection programs. And another link would be in chapter 13, where you want to look at how to accelerate the demographic transition and how to maximize the demographic dividend. So so this is how it is outlined, the Philippine Development Plan. I think one main difference with this plan compared to other plans is that we tried not to make it a sectoral plan. We just did like to make it a enumeration of the different sector agendas. So we try to look at it from a perspective of integration. Second, we have included initiatives that were not in previous plans. We have a chapter on culture and the arts, looking at the important contribution of culture to long-term development. We have a chapter on competition policy because it's a way of reducing inequalities in business and leveling the playing field for micro, small, and medium and enterprises. We have a chapter on administration of justice, a chapter on the demographic dividend, and science, technology, and innovation, which is not part of the previous plans. Now, let me focus on Chapter 10. And basically, a lot of these were also discussed by Secretary Obial in her video presentation. Chapter 10 has three main components because it's looking at accelerating human capital development. And for the plan, we're looking at it in the context of two things. We're looking at human capital development as an end in itself, and human capital development as a means to an end. And that's how we look at it. So in this chapter, we have three components. The first component is nutrition and health for all improved. The second component would be education, both looking at basic, tech, voc, and higher education. And the third component is looking at labor supply strategies that aim to raise the quality of human resources and those that enhance the functioning of the labor market, which would translate to increased income earning ability of Filipinos. That's basically looking at human capital development as a means to an end. And for the health and nutrition component, we have three subsector outcomes in the plan. So there are three subsector outcomes that were identified in improving nutrition and health for all. These are guaranteeing care at all life stages, ensure access through functional service delivery, and sustained health financing. So under these subsector outcomes, there are different strategies identified that I'll expound in the next slides. And these initiatives or these interventions is basically is what Secretary Obial said measures achieve. So it's achieve would be basically a summary of these different interventions. Under subsector outcome number 1, guaranteeing care at all life stages, the first strategy is to provide quality nutrition and health care interventions at all life stages to improve nutrition and health outcomes. Attention will be given to first 1,000 days of life, reproductive and sexual health, maternal, newborn, and child health, exclusive breastfeeding, complementary feeding, food and micronutrient supplementation, immunization, adolescent health. In addressing communicable diseases, focus will be on the concerns of HIV/AIDS, tuberculosis, and malaria. Again, the other interventions will be continue to address communicable and non-communicable diseases from urbanization, industrialization, attend to pandemics and travel medicine, as well as health consequences of climate change and disasters, strengthen efforts to address malnutrition in all its forms, and employ dedicated performance monitoring unit to track performance or progress of the reform to ensure quality. Under Strategy 2, there will be improvement of health-seeking behavior and target the most vulnerable. Health promotion for all interventions will be pursued. Vulnerable populations, the poor, persons with disabilities, indigenous peoples, and older persons will be prioritized in the provision of services. Specific and targeted interventions will also be provided like the conduct of annual health visits for the vulnerable populations. In subsector outcome 2, ensuring access through the functional service delivery, strategy 3 will ensure functional and efficient networks of healthcare providers. So your service delivery networks or SDNs will allow more of the population to reach health facilities and avail of needed services such as nutrition, reproductive health, drug management, and rehabilitation. Delivery of services will also be made more accessible through the use of ICT. Strategy 4 is to upgrade and equip health facilities and harness the power of strategic human resources for health. Additional resources will be provided for health facility enhancement, deployment of health human resources, vaccines, family planning commodities, medicines, and training. Selected hospitals will be transformed into mega hospitals or hospitals with multi-specialty training capabilities and reference laboratories. In subsector outcome 3, sustaining health financing, strategy 5 ensures that health insurance coverage will be expanded and that benefit packages will be improved. The National Health Insurance Program will continue to provide financial risk protection, ensuring that every Filipino will be a PhilHealth member, and there will also be improvements in and the development of new benefit packages that may lower members' out-of-pocket cost. And finally, there are also what we call cross-cutting strategies, or these are strategies that respond to the 3 subsector outcomes. These strategies include invest in e-health and data collection mechanisms for decision-making to address data gaps, and elicit multi-sector, multi-stakeholder support for nutrition and health. So basically that summarizes the health agenda in the Philippine Development Plan. But I guess it's not the only thing that you see when you look at health, because we're whole of government, whole of society, and a lot of interventions in other sectors will impact on health. And like OECD just came up with a report last month on the agriculture policy of the Philippines. And I may again be bashed for this, but saying that if we lower the price of rice by removing quantitative restrictions and tarifying rice, thereby bringing down the cost of rice, then that results to a 3 percentage point population decrease in malnutrition. So just by that act, you are addressing 3 million malnourished children in the Philippines. So it has to be looked at from whole of government and from other sectors, because especially the agriculture sector would heavily, and even the industry and the manufacturing sector will heavily impact health outcomes. So it has to be looked from that perspective of looking at, not only looking at initiatives within the health system or the industry, but also looking at other sectors that would impact health outcomes. Now, part of the plan is the results matrix, and the matrix basically will defines our targets over the next 6 years, and so they provide the baseline values and indicators, as well as in certain cases mid-plan targets, in certain cases end-of-plan targets. For the sector outcome on improving nutrition and health for all, the indicators are life expectancy at birth and total fertility rate. So those are the targets in the plan. And of course, these targets basically were vetted through and were determined by different agencies, particularly Department of Health, but also the PhilHealth, DSWD, the ALG, and a lot of the other related agencies. For the subsector outcome on guaranteeing care at all life stages, the indicators are your maternal mortality ratio, neonatal mortality rate, the infant mortality rate, under 5 mortality rate, premature mortality attributed to cardiovascular disease, cancer, diabetes, and chronic respiratory diseases, and death rate due to road traffic accidents. There are also nutrition indicators, including the proportion of households meeting intake, prevalence of stunting among children under 5, prevalence of wasting among children under 5, and prevalence of overweight among children under 5. On subsector outcome on ensuring access to functional service delivery networks, the indicators are the proportion of births attended by skilled health personnel, proportion of women of reproductive age who have their unmet need for modern family planning reduced, and modern contraceptive prevalence rate. And the plan also identifies this administration's priority legislative agenda. And for health and nutrition, these are increasing taxes on sugar-sweetened beverages and junk food that aims to lower consumption of sugar-sweetened beverages and junk foods through higher taxes. The Philippine HIV/AIDS law that seeks to address the rising incidence of HIV/AIDS in the country by restructuring the legal framework to harmonize evidence-informed strategies and approaches to the prevention, treatment, care, and support for HIV/AIDS. Also included in the list are the following: your Local Population Development Act that will provide for the establishment and operation of population offices to ensure the effective implementation of population management strategies and measures at the local level. The Prevention of Adolescent Pregnancy Act that will provide guidance for the formulation of a national policy in preventing teenage pregnancies and institutionalization of social protection for teenage parents. And the establishment of the National Mental Health Care Delivery System. And finally, the amendment of the law on the Barangay Nutrition Scholar Program to upgrade incentives and benefits and ensure security of tenure for the Barangay Nutrition Scholar. Again, we've laid down the guide and the roadmap over the next 6 years or 5 years and a half, and towards achieving our long-term vision for 2040. And the agenda is for the whole of society, government and the private sector and the communities to work together towards achieving the targeted health outcomes, target development outcomes, and towards achieving our long-term vision. With that, I'd like to thank you and have a great day. Thank you very much.
Thank you, Assistant Secretary Abad Santos. We invite you to post your reflections on the attainment of better health for all on our commitment wall.
Would be we commit to facilitate whole of government initiatives towards the achievement of UHC, towards achieving the SDG 2030 and achieving Ambition Natin 2040.
Thank you once again, Assistant Secretary Abad Santos.